Here's a quick review of the adult code card. So this is a standard code card. I just picked it up from Central Sterile today. The top drawer of a code card is always medications. So your med nurse is usually your critical care nurse or your emergency room nurse. They're the ones that really know how to administer medications. This inset can just be handed off if they'd like to do that, but all the medications are here in the top drawer. The second drawer has the things to give the medications. In addition, it has kind of some IV supplies. They are the old AutoGuards, so they may ask you for things off of your cart to start an IV. So IV start supplies, syringes and needles to drop some of the medications, extension tubing start kits, flushes, and tourniquets. Next is kind of your IV fluid drawer. So there is a bag of plain OR, which they may want, some smaller bags of normal saline, and then there's lidocaine, dopamine, and dobutamine that they may ask for, along with pump tubing. Next is some sterile procedures, supplies, so gowns, sterile gloves, sterile drapes. The next drawer down is everything breathing. So don't forget that there is an oxygen tank on your code card. There is also a bag of respiratory supplies. So generally, if you have a patient and respiratory is here, you can just hand them this whole bag. And there's also the ambibag supplies that we'll talk about here in a minute. There are flow meters, batteries, extra pads for the defibrillator, suction tubing, masks. So don't forget, if you have a patient that is still breathing, there is 100% non-rebreather that you could attach to your oxygen. So it would attach here at the back, where this nipple is, and then you would turn it all the way up. So for a non-rebreather, you need to have it on 12 to 15. So you're going to twist this dial all the way as far as it can go, or at least to about the 15 mark. You hit 15 to do a non-rebreather. If you have it on less than 12 to 15, they're actually rebreathing their carbon dioxide. So you're going to attach it back here, turn it up to at least the 15 mark. Is PPE. So here we have gloves. There's a central line kit that would kind of go with some of that sterile supplies in this drawer. There are stethoscopes. There's a blood pressure cuff, a manual one, a suction regulator and equipment. Usually there's a suction canister on the top. So the extra supplies for it, red bags, gowns, and eye shields. There used to be N95s in here. They are no longer. You would need to grab them from your unit supply. So some things that you can do